I am Dr. Edwin, a consultant laparoscopic, endoscopic and laser surgeon in Kins Hospital, 𝗂𝐚𝐮𝐬𝐿. We can talk about piles. What is piles? Piles means a protrusion of tissue, soft tissue through the anus. Who are all getting the piles? The people having chronic constipation, people who have obese persons, patient in prolonged sitting, that is due to poor lifestyle modification, and those who travel a long distance. These are the reasons why they get piles. And straining, heavy laborers. How to diagnose the piles? We can diagnose the piles by simple visit to the OPD of a hospital. A doctor can diagnose the piles. It may be a internal piles or external piles. And also, the reason to approach the hospital is most probably due to the bleeding per rectum. The bleeding per rectum, and also there may be itching or pain during defecation. If the bleeding per rectum, you should investigate by some investigations like anoscopy or 𝗂𝗵𝗿𝗶𝗶𝗏. It is mandatory to do at least a 𝗂𝗵𝗿𝗶𝗏 to rule out any malignant or benign lesions. After excluding the malignant lesions and also benign tumors, we can treat the piles. What are the methods available at present for the treating the piles? There is a surgical method and non-surgical method. For minor grades of piles, we can treat conservatively by medicines. Many medicines are available, and also for higher grades of piles, we can treat surgically. People are often afraid of surgery, so we can do the alternate and advanced mode of treatment is laser surgery. At present, laser surgery is booming in all over the world. If the laser surgery is done in a daycare procedure, patient can admit come to the OPD in the morning, can do the surgery, and evening we can discharge the patient to the home, and also he can resume his duties within 1 or 2 days. This is the advantage of laser surgery. We, Kins Hospital, and we are engaged in certain kinds of laser surgeries, like for hemorrhoids, that is for piles, the laser 𝗂𝗵𝗿𝗶𝗏, and also for fissure, and also for fistulas. And also we are doing endovenous laser ablation for varicose veins also. It has a very good result, and also patient can go home the very next day, and also he can resume his duties after a couple of days. It is a very good procedure, and it is one of the biggest advantage to the patients who are affected these kind of diseases. Thank you.